Welcome to This Explainer. Today, we're diving headfirst into the high-stakes science of emergency toxicology and life-saving antidotes. Have you ever wondered what actually happens when a life-saving medication is taken in excess or when a hazardous chemical enters the body? The clock starts ticking immediately. And the solution? Well, it's not just about treating symptoms. It's about applying precision chemistry. Picture a fast-paced emergency room, knowing exactly which antidote counteracts a dangerous overdose. That is quite literally the difference between life and death. The data we're looking at today details 21 specific pharmacological emergencies. Now, it's an intense list, for sure, but we're going to break it down and look at the brilliant chemical counterattacks that modern medicine uses to save lives.
Here's our agenda for today. 1. The science of antidotes. 2. Everyday overdoses. 3. Blood and heart medications. 4. Psychiatric and neurological drugs. 5. Heavy metals and toxins. And 6. Concluding thoughts.
Section 1. The science of antidotes. Counteracting the crisis. So what actually is an antidote? Well, it's essentially a targeted biological key. It's designed to lock down or completely reverse a very specific chemical threat in the body. When a toxin enters the system, it acts like a rogue agent. The antidotes we'll be exploring today don't just put a Band-Aid on the problem. No, they actively seek out that rogue agent and neutralize it, block it, or force your body to excrete it safely. Section 2. Everyday overdoses. Common hazards. You know, direct reversals actually exist for some of our most common household hazards. Take acetaminophen, a standard painkiller. If a patient overdoses on it, medical professionals immediately turn to NAC to protect the liver. For salicylates, which you'd find in everyday aspirin, activated charcoal is deployed to physically bind to the drug right in the stomach. But the approach shifts drastically when we're dealing with toxic alcohols. The precise mechanism used to combat dangerous alcohols is a perfect example of molecular interference. If someone ingests methanol, treatments like famotidine work specifically by acting as a potent inhibitor of the ADH enzyme. IV ethanol can also be utilized as a treatment here, but by blocking that specific ADH enzyme, famotidine essentially stops the body from breaking the alcohol down into far more toxic byproducts. It's a real game changer. Section 3. Blood and heart medications. Cardiovascular crises. Blood thinners are incredibly common, right? But if a patient's blood becomes too thin, they risk severe bleeding. To counteract a heparin overdose, the antidote is protamine. For warfarin, it's a massive dose of vitamin K. And if a patient suffers an overdose of digoxin, which is a medication used for heart failure, doctors deploy a highly specific antidote called Digibond to neutralize the threat circulating in the bloodstream. Now, this complexity scales up dramatically when dealing with heart rhythm regulators. If a patient overdoses on beta antagonists, the required antidote is a powerful 1-2 punch of glucagon and epinephrine. But if they overdose on calcium antagonists, well, the protocol demands a much more complex cocktail: calcium, glucagon, and a carefully balanced combination of insulin and dextrose. Cardiovascular stability isn't just about heart medications, it's heavily reliant on electrolytes. Notice how treating severe electrolyte imbalances often involves causing an intracellular shift, which basically means we're pushing the electrolyte back inside the cells where it belongs. For extreme magnesium, 10% calcium chloride is used to antagonize the cardiac effects. For dangerous potassium levels, treatments range from 10% calcium chloride to sodium bicarbonate to glucose and insulin, which causes that intracellular shift of potassium. We also use cationic exchange resins like sodium polystyrene sulfonate, which act like a chemical sponge, actually binding to the potassium to remove it from the body. Section 4. Psychiatric and neurological drugs. Nervous system interventions. When dealing with powerful antidepressants and sedatives, the clinical approaches are highly targeted. Overdoses of tricyclic antidepressants, or TCAs, require a toolkit including benzodiazepines, phenytoin, and physiostigmine. Meanwhile, SSRI overdoses are met with cycloheptadine. And if a patient overdoses on benzodiazepines themselves, doctors have a highly specific reversal agent on hand called flumazenil. But there is a glaring, crucial exception in psychiatric care, and that's lithium. The data bluntly states there is absolutely no effective pharmacological treatment or antidote for a lithium overdose. None. In this specific case, managing the patient and relying on prevention is paramount, simply because there is no magic chemical key to reverse it once it happens. Moving on to severe nervous system stimulants and depressants, we see the classic immediate reversals like naloxone or namifene for opiate overdoses. For the respiratory drug theophylline, activated charcoal and beta antagonists are deployed. But then we have cocaine, which presents a very unique challenge to toxicologists, requiring a highly symptom-based approach rather than a single universal antidote.
Because cocaine lacks that single magic bullet antidote, medical professionals literally have to triage the specific symptoms as they present in real time. If the patient is seizing, they get benzodiazepines. If their blood pressure spikes into dangerous hypertension, they're given labetalol. And if they present with severe psychosis, neuroleptics are administered. It's a dynamic, multi-front battle to stabilize the nervous system.
Section 5. Heavy metals and toxins. Extreme poisoning.
For intense toxic exposures, emergency medicine relies on heavy-duty chemical neutralizers. Cyanide poisoning triggers a triple threat protocol: amyl nitrate, sodium nitrate, and sodium thiosulfate. For severe lead poisoning, calcium disodium EDTA and BAL, also known as dimercaprol, are utilized. And for a toxic overdose of iron, the specific antidote is deferrisamine. The scientific strategy at play here is called chelation. This means the antidote, deferoxamine, literally binds itself on a molecular level to the toxic iron floating around in the patient's system. It essentially handcuffs the heavy metal so that the body can safely process and excrete it before it causes fatal organ damage. Pretty amazing, right? And finally, for harsh chemical agents like organophosphates, which are often found in heavy-duty pesticides, administering atropine and pralidoxamine is absolutely critical. Meanwhile, for an overdose of isoniazid, which is an antibiotic, the specific antidote is pyridoxine, utilized specifically to reverse the severe seizures induced by the drug. Section 6. Concluding thoughts. The ultimate matching game. So what does this all mean for us? From everyday medicines like acetaminophen to lethal heavy metals like lead and cyanide, successfully reversing a poison always comes down to pairing the exact chemical lock with its specific antidote key. Toxicology is the ultimate high-stakes matching game. There is no one-size-fits-all cure. Every single intervention relies on precise data, fast identification, and the immediate deployment of the correct countermolecule. The right molecule at the right time literally saves a life. If you found this explainer helpful in understanding the incredible science of emergency toxicology, please like, share, and subscribe to our channel. So, as we sign off, I'll leave you with this thought. In a world surrounded by powerful chemicals and medications, if you were the one rushing into that emergency room, would you know exactly which molecular key to reach for?